All right, start shooting. Maybe not literally, but go ahead. Questions? Surely I must tick somebody off. Yeah.
So the 1.1 trillion that you mentioned.
Yeah.
How does that compare to, as a percentage of GDP or whatever, compared to other industrialized nations that have socialized money? So are we just scared by that?
That's 1.1 trillion on top of the current spending. That's not a reduction. So that's just 1.1 trillion in new spending.
Okay.
It shifts it around some of it. Some of it is money that's shifted from state governments to the federal government. Some of it's shifted from federal government to the private sector and so on. But it's 1.1 trillion in new spending. I mean, essentially, healthcare reform is about giving more people more stuff. They like to pretend that you can do that for less money, but you can't. If you're going to give more stuff to more people, it's going to cost more money. Yeah. I'm sorry, again. No, it never levels off. Well, at least as far out as we can project. I mean, I can look at this out about 20 years. Now, in theory, there are efficiencies that will kick in somewhere and will reduce some of this cost. And that is likely to occur, although, to be honest, none of these efficiencies really seem to save money. For example, one of the things you hear all the time, everyone tells you preventive care saves money. Doesn't. Preventive care makes you healthier, which is a good thing. And I'm in favor of more preventive care. Preventive care does not actually save money. And the reason for that is preventive care is a shotgun approach. You end up applying preventive care to a lot of people who were never going to get sick in the first place, as well as to people who still get sick even after the preventive care. And some people, you prevent them from getting sick, but it's not enough to offset all the costs of the people you sort of misfired on, or that didn't need it. In the end, great studies in JAM and other, only about 20% of preventive care actually provides any sort of cost saving. Most of it is just an expenditure. So when they project these things and say we're going to be more efficient in the future, I'm skeptical. I mean, they haven't managed to be efficient about pretty much anything yet.
Yeah. You mentioned a lot of problems about healthcare reform. I was wondering what your opinion is on what you think is the right way to go about it.
Yeah, I would do three things to start off with. I think there's a lot of little things you can do, but I do three big things. Number one is I think we need to get away from an employer-based healthcare system. And I think the easiest way to do that is to switch around that tax treatment. As they say, right now, somebody's if they get that through their work, they get the tax break. If the boss gives them the money is to go buy your own insurance, they lose money on the deal. I think they should get the same tax break if they buy their own insurance as if the employer provides it. So you can get personal insurance. If you could buy personal portable insurance, it would stay with you your whole life. If you lost your job, you wouldn't lose your insurance. You still have it. If you buy it when you're young and healthy, you would keep it your whole life, so you wouldn't have to worry. I lost my insurance, then I came down with cancer, now I can't buy insurance. So you deal a lot with the pre-existing condition issue by keeping people insured. So I think that would go a long way towards fixing it. Second, I think the president's right. We don't have enough competition in the insurance markets. Two companies in Maine control 88% of the insurance market. One company in North Dakota has 94% of the insurance market. One company in Alabama has 80-some% of the insurance market, so on. They're protected in many ways, these little cartels, by state laws that prevent people from buying health insurance in any other state. If you live in Pennsylvania, you're here right now, you can't go to West Virginia and get a cheaper insurance policy, or over to Ohio and buy another insurance policy you find cheaper. Heck, you can't go online to eSurance and find the cheapest policy in the nation and just buy it. You have to buy whatever is for sale here, which protects the little cartels that exist here. I think that should be just opened up. There are 1,300 insurance companies nationwide. 400 of them are non-profit insurance companies. I think that people should just be able to go and buy whatever the cheapest insurance policy they can find is. And third, I think we also need more competition among providers. I think we need to open up the scope of practice for nurses, nurse practitioners, midwives, physician's assistants, and so on. Widely open up their scope of practice so that there's more competition among providers. I think that these mini clinics that they're opening up in supermarkets and so on, nurses should be able to take someone's blood pressure without a doctor standing in another room looking over his golf score while the nurse does the work. I mean, I think that should be opened up widely.
Two of all, you had said what you would do is that the individual buys their own insurance.
Yeah.
What about all these people that can't afford it?
Then I'll subsidize it. I mean, essentially,
So
yeah.
where does that money come from then?
Well, sure, but remember, we're not talking about everybody now. We're talking about 43% of the uninsured have incomes above, 200% poverty level. I don't think they need to be subsidized.
Okay.
I think it's, it's a low end. Sure, we need to let them play in the market. The question is, if you're going to have subsidies, though, I think it should be straightforward and transparent. Give them money. We know how much we're spending. We know who we're spending it on. Using the healthcare system to try to redistribute money is very inefficient, and it hits the wrong people. As I say, one of the things we say is that these people with who are older and sicker cost more for insurance. So we're going to try and redistribute money to them. Well, we're going to do it in the healthcare system by making young people pay more for them. Well, Bill Gates is going to get subsidized by some college kid who's making minimum wage working after school. What efficiency is there in that?
Yeah. And then my other question then, I'm sorry. Do you want to
No,
ask?
go right ahead. You can take follow.
A lot of people equate the new health reform bill to socialized medicine. What is your take on that?
I think it's not socialized medicine in the sense that the government employs the doctors or something. It's not the British system, the NHS system, or Scandinavian healthcare systems or anything like that. Is it what, pardon?
Would socialized medicine ever work here?
No, it wouldn't work here because Americans are not, two different things. Let me answer the last question first. In terms of would socialized medicine work here? Great polling results. They actually asked in Europe people, is it more important that you have the best healthcare that you can get, or that everybody gets an equal level of healthcare? The Europeans said everybody should get it equal. The Americans, it didn't even register. People said, no, I want all the healthcare. I'm sick. Everything that's there, give it to me. So we're not going to accept lesser quality for that. So I don't think that type of socialized medicine will work. I don't think it works very well in Europe either, but it's certainly not going to work here. This I don't think it's not socialized medicine. I think it's a shorthand type of. But what it is a transfer of who makes the decisions. If you look at under these bills, the bill, this 2,000-page bill, uses the word shall 3,345 times, as in you shall do this, or the government shall do that, or states shall do something else. It really is command and control. So, it creates 111 new boards and commissions and other government agencies to oversee all this under the Health Choices Commissioner, who is in charge of running, So it really is a transfer of power and authority there. They're going to tell you have to buy insurance, what type of insurance you have to buy. They're going to start telling, they're going to talk about how it's going to be reimbursed. All these things are going to run sort of like a public utility. Now, is that socialism? No, but it's government run, government controlled, and they haven't a very good job of running anything else that I've seen. So,